See important safety information at the end of the video.
Talking to a patient about weaning oral opioids is very important and often takes a fair amount of time. You have to talk to the patient in terms they understand. Patients naturally think more is better when it comes to systemic opioids. And what they don't understand is that more systemic opioids can actually worsen their pain and lead to more side effects and lead to worse outcomes. So you have to really introduce to them the concept of opioid-induced hyperalgesia, or OIH, in terms they can understand. A common thing that I'll often do is use an analogy. And the analogy I use is paying off your mortgage with a credit card. If you pay off your mortgage with a credit card, you get a nice letter from your mortgage bank that states, "Congratulations, your mortgage is paid in full." And you get euphoric from that, much like a patient can get euphoric from systemic opioids when the dose is first increased. However, about 30 days later, you get a bill from your credit card company, and now that is due with interest, and that euphoria goes away. But lo and behold, you have another credit card, and you pay off that credit card with that, and again, you get a letter paid in full. You feel euphoric, probably not as euphoric as you did last time. And this process goes on and on until finally there's no euphoria, there's no happiness, and the analogy being there's no pain relief, and things start getting worse as the interest piles up. So that's a story I often use, and patients seem to understand that. Often though, patients won't necessarily be ready to do a taper or a holiday, and they have to think about it for a while, and it's not unusual for a patient not to come back for a few months, and then when they're ready to come back and then undergo a trial and an implant if the trial is successful. So that's important, pointing out high pain scores, giving them an explanation of opioid-induced hyperalgesia in terms that they can understand, and if you can do that, you're going to have a higher success of getting patients to buy into this therapy. Expectation and goals are very important up front. Patients need to know that this therapy is not going to take their pain completely away. Most patients, when they come into a pain clinic, think that there's going to be a therapy that eradicates their pain. So the first thing you have to tell them, the first goal has to be significant pain relief, but not complete pain relief. And they have to get that, because if their expectation is complete pain relief, no matter what you do for them is going to fail. So that's the most important expectation, is significant pain relief, but not complete pain relief. Then I think it's a good idea for the patient themselves to write down simple goals, not unachievable goals, not complex goals, but simple goals, to write those down, and those should be documented in the chart in the electronic medical record, so that in the future you can bring those goals back to the patient and show the patient that they did in fact reach those goals and the therapy is successful.
Important safety information. The Synchromed 2 infusion system is approved for the long-term delivery of preservative-free morphine sulfate sterile solution and preservative-free ziconotide sterile solution directly to the fluid around the spinal cord for treatment of chronic pain. Targeted drug delivery should be considered after the patient has tried oral medications or other therapies that have failed or were associated with intolerable side effects. Implanting the system has possible risks, including infection, meningitis, spinal fluid leak, paralysis, headache, swelling, bleeding, and bruising. Pump or catheter problems can cause a patient to experience overdose or underdose and/or corrective surgery. Errors in inserting the needle into the pump refill septum during the refill procedure can result in medication being inadvertently injected into the pocket, resulting in an overdose that may be life-threatening or fatal. Drugs infused through the system may result in adverse events. Refer to appropriate drug labeling for prescribing information and detailed disclosure. Formulations not indicated in product labeling may contain neurotoxic preservatives, antimicrobials, or antioxidants, or may be incompatible with and damage the system. A prescription is required. Healthcare professionals must review the product technical manual and appropriate drug labeling prior to use for detailed disclosure. For complete safety information about Medtronic targeted drug delivery, call Medtronic at 800-328-0810 or visit Medtronic's website